I'm not sure which one.
Yeah, I'm not sure that we have, but that we will have the opportunity to reapply for the grant right away, but that's definitely something to keep on the, agenda, right?
Got it.
Okay, thank you guys for punting. I don't know if I dare share my screen or not.
Do you want
To share mine?
Yeah.
or one of us to share?
Try it. See if you can share. Perfect. Thanks for bearing with a little technological fun. Perfect. So, yeah, that slide works. So we'll go over our grant spending and sort of what we want to think about for the next year's allocation. And then we have a little activity around getting some group feedback about what we want to accomplish in this current year through the end of August 2023. And then what do we want to become after that? And then finally, we'll hear a little bit more about the education and outreach efforts and go from there. So on the reporting structure, I think it's pretty straightforward. I just wanted to clarify with folks, I'll only be working with the Behavioral Health Consortium as opposed to the CHIP work groups that I had been working with before. I know that public health is in the process of getting somebody to work on the CHIP side of things. And so I'm sure that news will be coming shortly. So I am happy to be working with you on the Behavioral Health Consortium specifically. And I think we're going to get a lot of good stuff done here in the next year or so, just under a year. So because we're going to talk about money, I thought I should remind everybody about this grant and what our focus was and where we're spending money currently. So the Behavioral Health Consortium group has all the members that you can see underneath the, sorry, I'm circling on mine, but you can't see me. You'll see the members there. You see the three main areas that we are focused on. And if you go to the next slide, Denise, thank you. You'll see we had all of these activities that this grant, which was $1 million, it started back in 2020. It goes through August of 2023. And in return for that money, HRSA was excited to receive a whole load of data at regular intervals throughout our grant with them. And we also needed to show that we had made progress on all of these activities that they specified under prevention, treatment, and recovery. And so to do that, and I think we can go to the next slide, we committed to, in our strategic plan with them, a series of projects. And some of them we made good progress on, and some of them we are going to make great progress on during the rest of this year. Our first one, the increase of the integration of provider prescriber resources, that happened pretty concisely with Safe Harbor and DBH coming in together. And that was actually a big coup, because I think at the beginning of the grant, I wasn't sure quite how we were going to make that happen. The second project was all of the work that we have done around data collection and analysis. And we actually collect data beyond, they call it the PIMS data. We collect data across our law enforcement, DBH, hospital, EMS, and a couple of providers. All are gathered together in a data work group, which we present to you usually twice a year. The second year, we might skip the last one and go to presenting again come March. But that is well underway. So money well spent on that. We develop and maintain both an online and a printed resource directory. And by the way, I invite you to put in the chat if anybody needs more of those yellow cards. I don't know how that supply has been running. And then improving the jail to community service connection. There's the fact that we're all at the table that I think allows us to perhaps better that that back and forth. But one of the main things that happened was we have a grant. We don't have it. I take that back. The jail has it, an RSAT grant that does helps with that aftercare, both in prison care and aftercare on the substance use disorder and connecting folks with services who have been through incarceration. So I feel like we've made progress on that one. The funding of the Recovery Cafe for peer network development and recovery prevention, providing a recovery and prevention friendly environment. We've funded them throughout this grant and will continue to through the end of August of 2023. So we can put a check mark next to that. The extension of harm reduction services into South County. Now I gotta say that Gabby and her mobile unit is one, tangible thing that's happening in terms of extending those harm reduction. We just heard recently from Denise about some South County work that's been going on with Jefferson County Public Health in terms of harm reduction. And we also have a group that meets regularly who has been looking at, among other things, a vending machine that would provide harm reduction supplies to folks in the area that they could stop at and get supplies from. Now that is still underway. I think at our next harm reduction meeting, we need to have a real serious pragmatic talk about, do we really want to get this done? How are we going to make it happen and start moving on that? If we're going to spend that money that we've allocated for that vending machine before the end of the grant. And then we've invested in having Anya do a lot of community engagement and education around stigma and naloxone. And I think that that's going really well. We might look at increasing that over the next 6 to 8 months so that we take the biggest advantage that we can of the funding that we've got to accomplish that sort of in a person-to-person way throughout our community. And then, so you see I have yellow checks by both number 6 harm reduction and number 7, because I think those are things that we're working on. We've got a good padding underneath us, but there's still more to be done before the end of the grant. And then number 8, the coordination and optimization of navigator and care coordination services. I'm not going to say that this grant gives money to that specifically, but we certainly, being at the table together, have seen the real team come online. And I think that the communication about how that is integrating and where we want to evolve whatever is happening there, we have a good table to make sure that that is getting the best chance at integration that it can throughout our county. And then the last thing that we hadn't made immense progress on, really any progress on, is the initiative around doing collective case management for high utilizers of law enforcement, hospital, and EMS services. But at the September summit meeting, we heard the hospital sort of announce that they were going to start looking at that and seeing how we could do that through across several of the players that are involved with these specific high utilizer clients. And I'm smiling because high utilizers, there's a nicer name for it. It's called friendly faces. So maybe I'll try to call them friendly faces. So we want to do something that allows us to be coordinated about our approach to some of the friendly faces that we have using all of our resources, and which gets very expensive as we keep cycling them through the system. So that's an overview of what we've been doing and what I think we still have left to do. And I am thanking Lisa Ray Thomas for the webinar that she has put up. We'll go have a look at that and see what interesting information is there. So as we look at the funding that has already either gone out or promised for the duration of this grant, I wanted you to see the amounts that we have going to the various programs. Recovery Cafe through the end of August, we'll get $155,000. I think you hear from Brian every month that we're on here. We know that good work is happening there. They're expanding the days that they're available and providing meals. Just in this last, I think it was just before I left that we okayed the funding for that. So that's a bit of an expansion. The OWL 360, we started by funding them with the Pfeiffer House, and there is the possibility of looking at doing something more with the Nest as that comes into being. And I don't know if you guys have already had a presentation about what the Nest is. I'm kind of looking for head nods or head shakes. Okay, all right. So that's something we'll get on the agenda for the next meeting. We have HFPD who we pay, that's Lisa Grundle, She helps us with our data analysis, our collective data analysis, and helps us think about how to use our insights that we get there in a strategic manner. Again, Anya, who has done the communication and education, she's gotten the 20,500-ish that she's using to date to do her work in our community. And then we've spent some money, of course, to create the website that we have and communications that are built, and we'll continue to use that over the rest of this year. The school-based health center, these last two things are things that haven't quite happened yet, but they're allocated in the budget. And one of those is to do a youth screening, brief intervention, and referral to treatment. The idea was that we would like to do that for more students, many students in our schools. The question is, if we, one, there's a process to integrate such a thing at the school-based health center, and two, if you are going to assess kids, do we have the resources to point them to once we know that there's a challenge? And I think that that's something that we need to talk our way through. So that 6,000 may or may not get spent on that by the end of August, but that's in the planning. So if you look at slide 8 now, thank you. We have about 100,000 left that we can allocate out. And I have put on this slide a few things that you might consider, or that we might as a group consider funding. And then I wanted to kind of open it up. If there are other things that you think should be on this list, you can tell I'm stepping back in after 3 months, so I don't have that really fresh insight that all of you guys do. And I wanted to take a couple of minutes just to hear from you if there are other things that you know of that impact how we could improve access to behavioral health services, that are programs or efforts that we could fund, and it would jive with the fact that that funding is going to end at the end of August of 2023. So I'm opening up the floor just to see if there's anything that people would like to mention, that they've thought of, that they'd like me to be doing more research on. Cherish.
So a couple of things, we've lost, funding for the Haynes Street cottages has changed around, and, often we don't have money for repairs there, and at Caswell Brown that, happened as a result of some of our friendly faces. That's what we're going to call them. So that's always a tough one at both of those locations. And then with the trash task force, cleaning up some of the encampments too. So those are some areas.
The hard part about this grant is it doesn't allow for any construction or remodeling. It needs to be a service that directly relates to those prevention, treatment, recovery activities that it wants us to check the box on. Very worthy, though. What you're talking about needs to be done. Means we should keep our ear to the ground for any kind of funding that we could manufacture a good story to funnel it that way. Thank you, Cherish. Other Chief Black.
Yeah, I was wondering if the grant would allow for interagency software. I think you mentioned it for tracking case management. With walls on data that we can't share, like HIPAA data, or if it was law, the law enforcement stuff that we can't see across agency partners. I know Gelato is one of those softwares that sanitizes the data across agencies, but being able to track contacts and patients would be really helpful, across all of our organizations. And maybe there's a different software that I don't know about that would be better even.
Well, I'm going to say quickly that I know that this is a very big topic, these bi-directional technology pipes that would go between all of our organizations. And it's a huge conversation at the state level, at the regional level. And I know that the big players that are around this table, I'm thinking hospital, maybe DBH, what everybody would like to see is an agreement or some sort of an edict that says this is the system that we're going to go with, and it's been thoughtfully chosen so that it works with everybody's system. So you note a huge issue, and I don't know if we've got our arms around it enough to spend money on any solution yet until some of those decisions get made at levels that are higher than us. And now I'm going to stop because Dr. Carlbaum might have more insight.
Yeah, I was going to say, I think that's one component of caring for these familiar faces. And I agree with the chief. I think it's a great idea. Just thinking about the care coordination thing that you mentioned, I wonder about prioritizing that, because I feel like other than this meeting, it's rare that all of us get together and talk about, well, I'm doing this and I'm doing this. And it seems like every meeting we're like, oh, you're doing that too. Oh, we should talk. Which is great, but I also wonder at the individual client level if there can be more coordination. And I think we have pretty good data. I think, is it HRQ data that the top 1% of the, what do you call them, familiar faces, burn up 20% of healthcare expenditure. And so it could be cost savings for the community if people had a better sense of all these different contacts. And we, I think, have built the teams, real team and navigators, and EMS is getting more comfortable with behavioral health. And I think our law enforcement colleagues are getting very comfortable, even more so than they used to be, with being often the point person for behavioral health. And just wondering about linking everyone together.
Maybe it's admin support, at the meeting, the Behavioral Health Summit, where Mary Fortman from the hospital was talking about that care coordination. I wonder if we could offer funding for administrative support to do everything that needs to happen to get folks around a table, permission so that people can share data properly, whatever that is involved, that could help the hospital or a collaborative of folks lead that. And Chief Black, I see you have your hand up.
It was up from before. I forgot to lower it, but I just wanted to add that I think we're already at a high level of communication across our agencies, and one of the barriers to going further would be a software such as Gelato that doesn't let all of the information that we have to legally protect in our silos cross the boundaries. So I think my impression is the will is there. I think it would be productive to consider an RFP for this grant for a software in a manager of that software to implement it. I know they're just coming online with the same program in Kitsap County that's going to touch CARES unit, law, mental health, the county, and obviously the hospital providers as well. So I think that would really be the next step, is so that we can sitting around the table, is kind of the easy part. And I think we're already doing that to a high degree.
I don't know if we're sitting around the table talking about specific cases, though, are we?
Well, there's certain things that we can't talk about on cases, and frankly, we don't have the time to go case by case. And I think that's the whole intent behind the software is, to optimize the connection to the high frequency users, and to, kind of take the place of sitting around the table and talking about this person and this user, and the software does that. So I think sitting around the table, I thought you meant sitting around the table strategically, not going case by case. I don't know that any of us has the capacity to go case by case.
I think that we were talking a quarterly meeting where we would pick, at least this was at the summit meeting, not at this table, but at the summit meeting, there'd be a quarterly meeting where they would focus on a couple of relevant, friendly faces that we want to work with in a collaborative way to maybe have them using our resources less. What I want to say about the idea of Gelato, and I know nothing about it, what I do know is that if we had to do anything that required an RFP, we could spend 4 to 6 months trying to do that, maybe get somebody on board, and then how do we fund that after August? So that's something to think about. I'm open to ideas. It's something we would need to move on really quickly if we were going to get anything out of it before the end of this grant.
Yeah, I could reach out to my contact with Paulsbo Fire, who spearheaded that project with their co-responder unit to
Mhm.
see what their process was, because I think they fast tracked it and funded it through a similar grant that they have to BHC.
Great. I'd be happy to have you connect me up with them. Denise, I saw your hand raised.
Yeah, I was just gonna go the same direction that Chief Black just went. And that was, if Kitsap County's doing something, then maybe we, check in with Kitsap County, and so that would be the Paulsbo, friend who was spearheading this. So that we
Great.
can figure out more completely just what steps that person took.
Right. That sounds great. Thank you, Chief Black. I'll appreciate the connection.
And Chief Black, if you have a link to the software, could you drop it in the chat? When I Google it, I get a lot of stuff about ice cream.
Are we spelling it wrong?
It's funny you say that, because I spelled it that way too. But I'll go through my email here and see if she puts a link
And
that I can share.
while you're doing that, Chief, could you briefly clarify for me, this is less of an EMR, an electronic medical record,
Mhm.
and more of a bidirectional pipeline, as Lori aptly said, to discuss cases like in general, or to specifically hone in on a specific friendly face and round around it.
Yeah, I am not that fluent with the product myself, and I know they just, there it is. I know they just implement it, but the way I understand it, and again, I was just like third hand, is when Paulsbo Fire goes out for a CARES contact with a friendly face, they're entering the data in there. They're not going into ESO necessarily if they don't have a medical need. But this gelato enters and preloads all of the information from previous contacts that may be from Paulsbo Cares, it may be from law, it may be from mental health, and then sanitizes the things that can't be shared. HIPAA compliance and law has a lot of rules as well. So that at least whoever's making contact at that moment in time has a little context for the best direction to navigate this person. And knowing that a little bit of the history, maybe not all the details, but it just in the field, it's more of a field tool to really help to right size the referral, in my opinion.
Fascinating. Thanks for the clarification. It reminds me as a nurse of a report at the beginning of shift. You're just sort of, you're getting that access of that patient's context before you move in and try to figure out how to triage your care for them.
Yeah, I would, if anybody's curious, I would highly encourage you to do a ride along with Paulsbo Cares. It's an amazing program. And in 4 hours, we did 10 or 12 contacts, and you could see the math with every single one of them, how we just not only got them the right referral, but reduced or eliminated future contacts. Not that we don't want to see the friendly faces or familiar faces, but at least reducing that and getting them the right service was really fascinating to watch how they're doing that.
Okay, well, we'll dig into it. Thank you for bringing it forward. Want to move quickly on to, I am looking to get input from you folks, both on milestones that we're at right now and what you're thinking, or if you're even starting to think about what we want to be after this grant is done. Now, there is a link on this slide, and I'm going to put it here in the chat as well. And if you go to this link,
And this is where it takes you.
Yep, there you go. It brings up a Padlet, and I am going to be quiet, and I'd like you guys to take the next few minutes, see if there's anything across there that you have something you'd like to say, and go ahead and put it in. And the good news is it's all anonymous. I can't tell who wrote what. So go ahead, put in some feedback, anything that comes to mind.
So Lori, maybe I'm slow gifted, but I'm clicking all kinds of places on this page and nothing's happening.
If you click on the plus underneath the column that you're interested in adding something to, it should bring up a,
I think it went to the feedback milestones slide. And nothing, I'm
You have
clicking.
to, you have to do it on the actual app, like you can't do it on her share screen.
Where did
Put it-
that go?
put
I
it in the
saw
chat.
it and it
In the chat,
disappeared.
Steve. If you go
Is
to
it in the chat?
click the link.
If
Okay.
you-
maybe if we turn off the share screen right now.
Okay, yeah.
There we go.
Yeah, that's probably confusing folks.
I got it now. Sorry.
I can totally see how that would happen.
I'm trying to find where to turn off the share screen, but my direction bar. Okay, I got it. My direction bar had disappeared.
I'm impressed with whoever made their comment pink. Gabby, I can see you just joined. I don't know if you're able to, but folks are putting input into a Padlet, which is just a place where you can give feedback. If you clicked on the link in the chat, it would take you to the Padlet.
I probably am in the middle of the jungle. Probably can't, but I will try.
Okay, and no worries if you can't.
Can you email it to me if it's something I need to fill out?
Absolutely.
Perfect. It's not letting me. Sorry.
No worries, no worries. The beautiful thing about doing it this way is it's an artifact that we've captured everybody's feedback, so we can go back and look at it later.
Okay.
I'll give everybody 2 more minutes. Man, and somebody made a green one. Even I don't know how to do that. Oh, and purple and blue.
Lori, while people are doing this, this is Lisa. Hi, this is great. Is this a free service?
It's not quite free, but I think it was worth my investment. I use it across a few different clients, and it's been really helpful as a place to gather feedback quickly and have an artifact after the meeting that has it all captured.
Right, and we've been looking for ways to let people comment anonymously, especially since when we're including people with lived and living experience.
Yes, yeah, I can send you a link. Very useful. I found it very useful. Okay. Thank you, everybody, for spending some time and sharing your thoughts in there. I'm sure we'll come back to this and talk about it at another meeting. We're at 3:54. I wanted to see if there's anything that anybody would like to share or ask before we take off, go to the rest of our day. It's so weird to be doing this without having the slides up there. Oh, I do see that Anya was going to give a quick update on the education and engagement piece of things. Anya, you might also talk about if we were to come up with some more funding, what other things you see that might be useful to do in the community that we aren't doing already.
Sounds good. Yeah, I wanted to give a quick update. I did a count of all of the last 6 months. I've distributed 313 boxes of naloxone directly into our community. So felt really good about that number. I know Ocean at the syringe clinic said that in the past public health has averaged about 50 boxes a year. So that's a huge increase of folks knowing what naloxone is and how to access it and what other services related to that are. And I'm also really excited that Ocean and folks at public health have now purchased fentanyl test strips. So working with Ocean and Dr. Carlbaum, I know we're trying to figure out strategic ways to get that out into the community. So for me, I'm going to be making little packets like public health has with the 3 strips and instructions on how to use them. And I'm not going to be putting them in the naloxone kits because they might have different audiences of who wants those, but I'll be distributing them at the same time and then wanting to do more outreach directly to kind of more vulnerable communities. And this kind of goes into some other projects that I could do with some expanded support. So right now, my main goal is to do at least 1 to 2 events a month and to be getting naloxone out. And there's lots of other asks and needs around education and prevention. Sometimes people, when I'm tabling, will ask like, hey, could you come to my place of work and give a presentation on how to use these? And when I was doing outreach around Overdose Awareness Day and putting up flyers at the cannabis dispensaries and at the bars and having conversations with workers there. Some folks and some workers requested like, oh, could you come in here? Could we do some kind of training for our employees? So doing some more like community-wide trainings for service workers or maybe folks who might have that direct contact with folks who are using substances. As well as I was having a conversation with Ocean about how it'd be great to have some kind of like virtual offerings to let folks know that we have fentanyl test strips now and we have smoking supplies. So we talked about potentially putting together either like a YouTube video that we would present and talk about. Maybe some folks in this space could give some background on their resources. And also in addition to, or instead of potentially like a live Zoom webinar, maybe a couple times a year, like this is what we're doing for overdose education and prevention in our community. This is how like the impact that it's having in our community. And these are ways that community members can be active and take action and be prepared for these kind of events. Yeah, and then I would also like to be right now it feels like most folks in my target demographic is kind of like the general public, a lot of like working class people who are wanting to know more about naloxone and how to be prepared, but not really specifically like the most vulnerable people in our community and like unhoused folks. And inspired by the work that Ocean's doing over at Public Health, I would like to join them more, and other folks like Gabby who are going out into the community and going into behind DSHS and going into some of these transitional living facilities and teeny house villages and just like offering services there. So those are some ideas for how we could expand on this stigma and outreach work. Folks have other ideas or feedback, I'd love to hear them.
Okay, thank you, Anya. Anything else? Our next meeting is set for December 8th, 3 p.m. We'll look forward to seeing you. Please feel free to reach out. You all have my email on the invitation, and I welcome any feedback. Anything else before we go?
I just wanted to indicate that what I'm going to do after this meeting is go into my calendar and cancel the former invitation that I had in the interim while Lori was not at the meeting. I don't want that to confuse anybody anymore. And it seems like everybody figured it out today, but it's taking up space on my own calendar, and I figure it is on yours, so you need not have a duplicate. So look for that cancellation so it'll disappear from your calendar. Does that make sense?
Thank you, Apple.
Yeah.
Thank you, Apple. Anything else? All right, go forth. Have a great afternoon.